Okay, so we can get started. So again, welcome to our information session for our graduate programs in population health management. Today on the call, we have a few people that would love to talk about the program. For starters, my name is Morgan Fredericks. I am the admissions officer for our Master of Applied Science programs and the affiliated certificates related to them. On the slide, we also have Dr. Mark Biddle. Unfortunately, he won't be joining us for our call today, but he is the program director for this program. However, we do have Dr. David Baker, so I will allow him to introduce himself.
Yeah, hi everyone, and welcome. Thanks for joining us today. So I'm Dave Baker. I'm the co-director of the program. I also teach a course in the program on really assessing the impact and effectiveness of population health management programs using a variety of national measures and also several frameworks. And I also, in sort of my other time, I have a full-time job as executive director of population and community health management at LifeBridge Health here in the Baltimore region of Maryland. And I'll pass it over to Debra Thompson, who is faculty and also was a former student in the program.
Thank you, Dr. Baker. Hello, everyone. I'm Debra Thompson from Eastern North Carolina, very rural community. And I am a nurse. I have 41 years of healthcare experience. And currently I am, in my full-time job, president of Access East, which is a care management company that provides services for a health system in Eastern North Carolina, which is part of our population health management work.
Thank you again so much for joining us, Deborah.
Glad to be here.
Okay, so I will highlight the agenda of what we will be talking about today. So we'll start talking about a little bit of the population health industry overview. We'll touch base on the program details, curriculum. You'll learn a little bit more about online learning here at Johns Hopkins, highlight some of our amazing faculty and alumni. Chat about the admissions requirements, chat about tuition, financial aid, and then we will end with a little bit of a Q&A. So I will pass it over to Dave to get us started.
Great, thanks, Morgan. And I just want to start a little bit by talking about some of the driving forces behind population health as a topic in healthcare. Our own Dr. Josh Sharfstein has noted that population health managers who can draw upon public health tools will be the leaders of tomorrow's healthcare system. And there's a lot of sort of change going on in healthcare right now. We know that the U.S. healthcare system has evolved to be sort of a very fragmented system and really sort of tends to be based more on focusing on treating acute care episodes rather than sort of the continuum of care that most patients need. There are increased demands for accountability in the management of healthcare resources, as well as the financial, political, and social winds of change. And really that's at the national sort of CMS, Medicare, Medicaid level, as well as the state and the local level. And in our program, we do talk about sort of different examples of how some states and localities are really kind of leading the way in innovative thinking and application of population health management frameworks. There is a shift from volume-based to value-based reimbursement models. And this is happening again with Medicare, Medicaid, but also with a lot of insurance plans, and especially with a lot of the Medicaid MCO plans. And, there's general acknowledgement now that improving health requires a focus on determinants of health, some of the social aspects beyond the sort of clinical episode of care. And really by focusing on those and by improving those social determinants, you can really make a lasting impact before the patient has to go to a hospital or an emergency department with an acute episode. So really population health management as a subject brings focus to the health of populations and really promotes the integration of public health practice, use of tools into the management and delivery of healthcare services. And I want to share a little bit about population health management at Johns Hopkins. So population health management, as I mentioned, has emerged as an important strategy for healthcare providers and payers. At Hopkins and at the School of Public Health, population health management was among the first two programs in the country to focus exclusively on population health management. And this is back in 2017. In 2022, the Population Health Management Program was among the first 5 to receive the certificate by the Commission on Accreditation of Healthcare Management Education, or CAME. And our interdisciplinary program really provides you, experienced professionals, with a comprehensive approach to developing population health management systems and strategies, and really leading to this more value-based, population-focused model of value-driven and accountable care. And just a final thing, our interdisciplinary curriculum examines the importance of these social determinants of health and includes medical care, a focus on public health, genetics, personal behaviors and lifestyle, and a broad range of these social, environmental, and economic factors, because we know a lot of these are sort of the upstream factors that contribute to poor health downstream. So let's go to the next slide. So speaking about careers in population health, so our program is targeted toward clinicians and managers who are actively engaged in transforming health systems, hospitals into more value-based, population-focused care delivery organizations. So the program is really meant to be very practical and provide tools that you can use as you're learning them in your job. And we really find from our prior students that this has really been a helpful model for them in kind of practicing as they learn. Overall, in the US, there's a high demand for healthcare administration and management jobs with about a 17% growth rate. The concepts of population and community health management appeal to and can benefit a wide range of busy healthcare professionals, and is an essential base of knowledge for really any healthcare executives. Some examples of healthcare positions that this program can benefit includes positions like Vice President of Population and/or Community Health, Director of Healthcare Integration, Director of Community Health Operations, Population Health Initiatives Managers. And there is a quote I just want to share with you from one of our current students who said, I recently interviewed for a director in social determinants of health position at a regional health information exchange. I'm happy to share I leaned on my population health knowledge, including using an assignment example. I used my veteran suicide health education promotion intervention assignment to demonstrate my competency. I want to thank you for building a strong skills-based program. So let's look at the next slide. Some details about the program. So really there are two options in terms of the types of programs you can apply to. The first is the sort of one-year graduate certificate in population health management. So this is one academic year and it encompasses 25 term credits. The other is the 2-year Master of Applied Science in Population Health Management. And this tends to be what most of our students enroll in. This is 2 academic years, 50 term credits. Each academic year has 4 terms of about 8 weeks in length. And the master's program includes, of course, courses as well as professional development and an integrative activity, sort of a capstone program at the end of the overall 2-year program. Our courses and the program is really skills-based, and it's really intended for people who are working. It's part-time and it's 100% online because we recognize you're working, and it allows you to kind of fit in your education when it's best for you. It is pedagogically contemporary. So we have group learning as well as peer assessment built into the program. It's skills oriented, so you'll be doing projects. We'll be discussing a lot of examples and giving you some hands-on learning opportunities. The program focuses really on understanding and leading population health management systems to improve health within and across different populations. Next slide.
Yep. And one quick thing I wanted to note, thank you so much, Dave. You highlighted that the program, the certificate can be completed in as little as 1 year, the Masters of Applied Science in little as 2 years. But we do allow students to kind of slow the program down a little bit. So completing it in those timeframes means you're taking 2 courses at a time. But some students, we understand, are super duper busy and just want to take their time matriculating through the program. So we do allow you to kind of stretch it out a little bit, take 1 course at a time, complete the Masters of Applied Science in 2 years, 4 years, whatever works kind of best for your schedule.
Great, thanks for noting that. Great, and I'm just going to quickly go over the curriculum for both the sort of the first year. This is an example of the certificate curriculum. So your first term will be academic and research ethics, essentials of population health management, principles and applications of advanced payment models in population health management. Second term, its focus is on collective impact, developing and leading community partnerships to improve population health. And the second course in that term is the one I teach, Accountable Care, Assessing Quality and Effectiveness of Population Health Initiatives. In the third term, the course is Population and Consumer Health Informatics, and an Introduction to Epidemiology. And in the fourth term, the course is Statistical Concepts in Public Health, followed by, and also Managing Health Across the Continuum, Contemporary Models of Disease Prevention and Care Management. And if we go to the next slide, we see that the year 1 curriculum is the same as the curriculum I just went over for the certificate program. Year 2 adds applied concepts and foundations of high performance for population health and health behavior, improving health through health education and promotion. In the second term of year 2, organizing for public health, systems approach, and behavioral economics and risk, value-based payment methods and incentives. In the third term, the built environment, influences and challenges to improving population health, and value-based concepts of socially responsible leadership. In the fourth term of year 2, that's when you have that integrative sort of cornerstone or capstone activity where you take all of the tools and learnings from the prior terms and really apply it to an actual case that we provide to you. And the other course is social and cultural basis for community and primary health programs.
Yes, and you definitely can see this in this slide, and Dave chatted about it, but the coursework for the certificate program, I just want to highlight, is the first year of the coursework for the MAS program. So we do have some students that complete the certificate program, maybe take a little break, and then they just come back and apply to the MAS program. So that is most certainly an option as well.
Absolutely. So, and to speak a little bit more about online learning, so Hopkins has over 20 years of experience in online learning. And so our courses are developed with really high production value, and we have online course activities that are really designed to keep you engaged throughout the program. We do have a hybrid model of both asynchronous, sort of kind of ongoing courses and lectures, but we also have synchronous sessions where we allow for peer-to-peer collaboration and interaction with faculty, between faculty and students. And this is all through Zoom-supported sessions. As I mentioned, faculty have recorded course lectures, and again, you can kind of access them anytime that works for you and in your schedule. We also provide a 24/7 help desk. So if you need any help with sort of accessing things through Course Plus, which is the online learning platform we use, you can call them and they can help you.
Yeah.
Um,
And then just a quick note about the synchronous sessions that you mentioned, Dave. They are great. Students have a lot of good feedback about being able to kind of collaborate in that type of manner. At the same time, all over the world. So sometimes they're not able to make it to a live talk, and that's totally okay. You'll be able to definitely, watch the recording of the live talk at a later date.
Great, thank you. And and this is just a kind of a list of the faculty for the program. And just wanted to make the point that we have a very interdisciplinary team of faculty. So from various fields in population and public health. So you see underneath the list of names, you'll see the department affiliation. So we have folks from, of course, health policy and management, as well as international health, biostats, health behavior and society, mental health, environmental health, and engineering. And Morgan, do you want to take this?
Yep, absolutely. So love to chat more about our admissions requirements and the process of enrolling. So to get started with us, you would have to, of course, submit an application. Now, if you are looking to apply for the MAS program, that application would go through SOFAS. If you're looking to apply to the certificate program, that application would go through SOFAS Express. For both of the programs, we require students to have completed a bachelor's degree from an accredited university or college, and have about 3 years minimum experience, work experience in a health-related field. Um, that can be highlighted in your resume, that can be highlighted, in the statement of purpose that you would need to upload. I will say, I personally think the statement of purpose is one of the most important aspects of your application. It gives you the opportunity to really introduce yourself to the admissions committee. I think it's important for applicants to really express their understanding of the program, why they feel the program would be a great fit for them, and how they plan on using the skills and knowledge learned in the program in their career. Dave mentioned that one of the models of our program is to have students, take the knowledge and skills they learn and like hit the ground running, and ideally apply it to their job the next day. We want to really see how you can do that, your plans to do that. Another thing you would need for the application process would be letters of recommendation. For the certificate program, you need a minimum of 1 letter of recommendation. For the MAS program, you would need a minimum of 3 letters of recommendation. However, for both programs, you can submit a maximum of 5 recommendations or letters of recommendations. Now, I would suggest doing that, let's say if your application maybe fell short in an area or two, maybe you barely barely made the 3 years health-related experience and you really want to kind of boost yourself up, I think that's a great reason to have all 5 letters of recommendation submitted or requested. For international students, you would need to do everything that I mentioned previously, but 2 additional things. So one, possibly you would have to take an English proficiency exam. There are different ways that the exam can be waived, so feel free to definitely reach out and we can chat about that a little bit more. But some quick examples are if you've attended a 4-year university in the States, things of that nature. Um, Also, international students would have to have a course by course credential evaluation for all of their transcripts that were not taken in the United States or English speaking Canada. Again, if you have any questions about that, you can always reach out and we can kind of go a little bit deeper into that process as well. So applications are reviewed on a rolling basis. Although our deadline is July 1st of 2025, we really would suggest you apply sooner rather than later. Once your application is actually submitted and verified, we try to get admissions decisions out to applicants within about 2 weeks, ideally. But yes, definitely submit your application sooner rather than later. Sometimes students think that the application process will be very quick, and sometimes it can, but sometimes things take a little bit longer than we anticipate, such as getting that final letter of recommendation in or having your transcripts evaluated. Especially if you're an international student, I would say start your application yesterday because sometimes those West transcripts evaluations take a lot longer than we all anticipate. Okay, so let's talk a little bit about the tuition for the program. So the current full tuition for the program is $1,374. However, we are offering all students in the MAS and certificate program a scholarship that covers about 38% of the tuition. So that brings your cost per credit down from 1374 to about 846. Now you would be charged each term depending on how many credits you take. So if you're taking 2 classes per term, you would be charged, for 6 credits. If you're taking 1 class per term, you will be charged for 3 credits. So that makes a difference on how you kind of fund your program sometimes. Let's see. Again, you do not have to submit an application to receive that scholarship. Once you're admitted into the program, you would already be awarded that scholarship. Outside of the scholarships, we do have a Office of Financial Aid that also helps students with funding. If you have additional funding questions, definitely reach out to me as well. I have a list of some scholarships that students have previously applied for. I always suggest, looking for outside scholarships as well, so we can always touch base on that privately. Okay, so I am going to hand it back to Dave and we'll talk a little bit with Deborah about her experience with the program. And then we'll open
Yeah,
it up for a Q&A.
absolutely. Thanks, Morgan. I did want to pass it over to Debra Thompson, who, as I mentioned, is one of our faculty, but she was also a student. Debra, maybe you can speak a little bit about your experience as a student. I think you're on mute.
Oh, thank you for that. I must have clicked it twice. Sorry about that. So when I completed my doctoral program, I had decided at that point that had fulfilled my educational, desires and from here out would be work. But I will tell you, as you heard Dr. Baker mention, healthcare landscape is changing, and yeah, I was beginning to be exposed to some early value-based contracting and that type of thing. And we were starting down the avenue of population health management. And so I was looking for just some online study or some type of program that could help me be better prepared for the work that I knew was coming ahead. And I happened to just discover Johns Hopkins Population Health Management Program, and they were just putting the first course or the cohort out. And when I began to look at the topics and the content that was being provided within this program, I just knew this is where I needed to be in order to be prepared for the change that was coming. In Eastern North Carolina is very rural, but we have a lot of health needs, and I knew that we would be challenged in order to be able to meet the needs for the health system to be successful, and not only value-based contracting, but also in the whole realm of population health management. And so my experience with Johns Hopkins was positive from the very beginning. And I'll just say from the application process, I was very surprised with just how easy it was to submit the things that I needed to submit, because I've done several online programs, in fact, 3. The Johns Hopkins was my third one, and by far the most succinct and focused in getting that work in. The curriculum itself, I will tell you that the 2 years went by pretty quickly. So staying on top of the assignments is very important. But I found myself becoming even more engaged and wanting to learn more as the programs were going along. And it really met my needs. And I will tell you, when I graduated in 2019, as Morgan said, I felt prepared to day one step into the role that I didn't know at the time when I first started was preparing me to take on the whole care management arm of this health system. And I felt very prepared to do that. The skills and things that I learned in this program, I have implemented every day. And so I became part of the population health management team here. And it has really been very fulfilling, not only for my career, but also the success that our health system has had in population health management.
Thanks for sharing that, Deborah. That's great. And I think now we can open it up to questions. Would be happy to answer any questions from the folks dialed in. And you can feel free to ask about really anything, whether it's courses, the online format, anything else, group work. If easier, you can also put it in the chat. If you have questions, we'd be happy to answer through that format too.
While we're waiting for some questions to come through, I will share that there are other population health programs out there. And there were, when I applied for the 2019 program, or the 2017 completing in 2019, but I compared Johns Hopkins with those other universities, and they're well-known and great universities, but I felt that Johns Hopkins provided the most comprehensive program, and I felt very comfortable with the content that I saw. And I can say now that on the backside of that was the right choice for me to make, because the skill set that I learned along the way and am able to implement every day in the work that I'm doing was spot on for where we are. And so it was the right choice. And I would say to anyone that's looking, it is a very, very strong program, and it provides you the foundation that you will need in order to be successful and implementing any part of the population health management program.
That's great. Thanks, Deborah. And I just want to mention too that we're fortunate the Hopkins School of Public Health is ranked #1 in the nation. So that definitely helps in terms of job advancement and career advancement.
Okay, while we are waiting for more questions, Deborah, would you mind sharing with us a little bit about the relationships that you've built throughout this program with other students, faculty, things of that nature?
Definitely. So as you heard in the introduction, I am now on faculty at Johns Hopkins, and that's a wonderful experience. Not only working with the other faculty, but also getting to hear and learn from students from across the globe. And that's one thing that's I think is very valuable in this particular program is that you hear from students not only in the US, but also across other countries. And we learn from each other challenges and also what's going on in healthcare there and how we can actually learn from each other and then implement strategies that has worked or even pilot some of those strategies. So that's very key as well. The faculty, I'll talk about the quality of the faculty. They are experts in their field, well known, and if you just go out and search, you will read and hear about just all the great knowledge and skill that they bring to Johns Hopkins. It definitely is the best of the best. So feel really great about the guidance that you're going to have and what you're going to learn along the way. And I still keep up with some of those students that I was a part of for those 2 years. And also as I taught the last couple of years, also some of those students as well, we keep up with each other and share what's going on in the world of pop health and different fields or areas that they're working in as well. And so it's always a continual learning process, but your foundation is so critical. And I'd say it's a very strong foundation here. One of the things I'll share that has been new for me since I think the last time that I spoke is that the company that I'm heading now, we were awarded a multi-million-dollar award as one of the demonstration projects through CMS. And so we are studying the impact of social determinants on healthcare costs and outcomes. And so we're one of 3 pilots across the state of North Carolina. And so we are implementing through human service organizations, social programs within food insecurity, transportation insecurity, housing, and interpersonal violence. And we are looking at the overall impact of not only care managing those individuals that are very high risk in Medicaid, but also the impact of providing those services to them and paying those HSOs or human service organizations for that work, and then evaluating the outcome. And it has been published now, so I can share that the first evaluation so far has been $85 savings per member per month for those enrollees. So that's been the first year, and it's a 3-year project that we're working on, and hopefully we'll hear soon if we're going to be able to extend that out for another 3 to 5 years. So very exciting work, cutting edge, and a lot of what I learned about the community hubs and such I learned that at Johns Hopkins. And so it's been very valuable being able to take some of that information and in this new way of healthcare that we're in now, being able to incorporate that and continue that process moving forward.
Thank you so much. So again, I want to give the opportunity for anyone on the call to feel free to ask any questions to any of our presenters. We would definitely love to make sure your questions are answered before we end our session today.
Hello, my name is Miss Lu, and I have a quick question. Thank you for today's session. Related to today's session, I thought the program listed so fast was related to health equity and community health. But earlier you mentioned that it's more for clinicians and managers. So is this program intended for a hospital executive? If I understand right.
So broadly speaking, we want to have people with healthcare experience. So it doesn't necessarily have to be clinicians, although we do have a number of clinicians, nurses, physicians, but we also have administrative staff. people, pharmacists, people who work sort of in all areas of healthcare. It's really open to a broad group of people. But we want to make sure folks have at least 3 years of working experience so they can sort of understand kind of how the healthcare system works. Did that answer your question, or is there another question I can kind of help with?
Yeah, thank you so much.
I'll just add also, I'm glad you asked that question. Just thinking back to last year and the course that I taught, we had participants there that were from the payer background. And Dr. Baker mentioned pharmacy background. It really takes an interdisciplinary team to do this work really, really well. And so I would encourage you to, if you have concerns, to please reach out and just have a conversation on whether it's on this call or if you feel more comfortable through email or so. We would really love to talk to you about that because it does take a team. I work with a team of social workers, from IT specialists to analysts to quality personnel. We're all on that same team working toward those same goals. And so know that you have a seat at the table, and knowledge of population health is very critical for where all of our systems are moving forward.
Yeah, that's well said.
Okay, any last minute questions before we make our final remarks today? Okay, well, feel free, if you think of any questions, to reach out to me. My email and phone number are on the screen. So more than happy to chat with all of our applicants, prospective students. Want to take the time to, again, thank Debra and Dave for joining us for the call. Again, last plug to get started on your applications. I am definitely here to assist you throughout the entire application process. So again, feel free to reach out. Any last words, Dave?
No, just thank you everyone for joining. And I think Morgan, a recording of this, if folks have missed part of it or had to jump off early, will be available on the course website or on the program website.
Yep. So definitely will be uploaded by tomorrow. And then I will send the recording to everyone who registered for the event and may not have seen the whole entire presentation or may have missed it. So we'll get it out there. All right. Well, again, thank you everyone so much for joining. Have a wonderful rest of your day.
Thank you.
Thank you. Take care.
Bye-bye.